Hi, my name is David Sakin. I'm the lead technologist in Blood Bank at Littleton Regional Healthcare. I'm here today to talk to you about careers in clinical laboratory science. To work in the laboratory, you need to have either a 2-year degree, associate's degree, or a 4-year Bachelor of Science degree. You can get these in clinical laboratory science, or you can have a science degree and take a clinical internship and be eligible to become certified as a clinical laboratory scientist. Depending on if you work in like a large hospital or a small hospital, the job descriptions are a little bit different. In a small hospital, associate degree techs and 4-year techs pretty much do the same job. In larger institutions, particularly teaching institutions, 4-year degree people tend to be in administrative positions eventually, whereas most of the technical work will be done by associate degree people, except in specific technologies, particularly microbiology and blood bank, usually require a 4-year degree person. We're going to walk through the laboratory and discuss what happens in each area, and then we'll discuss a little bit more about what you can do with a degree in these programs. So if you'll follow me, we're going to walk this way, and we're going to start in the blood bank, since that's my area of expertise. And what do we have in blood bank? We have blood. Not as much as I'd like to have, but it's here for the people that need it. We have red blood cells. Let's take one out. We have red blood cells, which you get, pardon me, if you need to have oxygen carrying capacity. You don't need whole blood. If you've ever donated blood, you've noticed that the bag is a lot fuller than that. If you don't need red blood cells, but say you need to have coagulation therapy, we have the liquid part of the blood, which is called plasma, and it's frozen. And say you take your blood thinner and if you have too much, we can give you some of this and it will ameliorate the process unless the doctor feels that he can wait and treat you with vitamin K. Let's walk, turn around. This is the area that we do urinalysis, serology, pregnancy tests, strep screens. We can look for different bacteria in your urine. We do lots of tests on stools. We look for blood. We look for white cell byproducts. We can look for parasites. This is a small hospital lab, so we have an overhead parasite test that gets them sent away to the reference lab where we can do the initial screening here. We're going to walk over to hematology. If you've ever had a blood count or platelet count, that testing was done here. We're going to walk up this way a little bit. The instrumentation is marvelous. When I started in laboratory science, which was, I won't say how long ago, we had to do a lot of manual counts. When you figure there's like 4 to 6 million red blood cells per cubic millimeter, those were very labor intensive. Now these instruments can do an entire complete blood count in about a minute and a half. We talked about frozen plasma, and I showed it to you, and the doctor would have a specimen, and we can check your coagulation systems, automated. It used to be a manual test. It was a lot quicker than it was now, but it was really subjective based on how well the tech tilted the tubes. Now it's automated, standardizes everything. We do other testing in this area. We can look for, if you have Lyme disease, we can look for antibodies to Lyme disease. We can look at your lung function tests on this instrument. It's all with blood. So now we're going to walk into chemistry. Chemistry is the most highly automated area that we have. We're going to walk around this way just because they're on the phone right now. So this is clinical chemistry, heavily automated. The instrumentation is massive. It's not my area of expertise. I can press run. The women that run these machines, they can take them apart and fix a lot of stuff. But the companies also provide preventive maintenance. They'll send service technicians in to make sure the instruments are running fine on a regular basis, or if the instruments are down, they have techs that come in pretty much within a couple of hours most of the time to make sure that the instruments are up and running. Now we're going to walk over to microbiology. I have to show you my back, but we're coming in. This is microbiology. Come on in. Once again, we do gram stains. We identify bacteria. In a larger hospital, you might do virology testing. You might also do testing on funguses. And we talked about overhead parasite testing in a lot of hospitals, bigger places. That's also done in microbiology, or a separate parasitology area. Once again, heavily automated. Lots of computers, plates, agar plates. If you ever take a micro course, we use all different types of agar. It helps identify the bacteria. And we're going to turn right around, and we're just going to show this room right here. Just going in there. This is the area we do a lot of now PCR testing, where we used to grow bacteria. Now it's all done. A lot of it's done using PCR, and we're looking for the bacteria genomes instead of the bacteria themselves. We're also doing a COVID-19 test here in this area of the hospital. So now we're going to go back and we're going to talk a little bit about what you can do with a degree in medical laboratory science as a clinical laboratory scientist. You can work in a hospital lab. You can work in a doctor's office. A lot of doctor's offices have their own laboratories. You can work in research. All of these test kits are developed usually at big universities in the research area, and then the lab tests are developed and released for public consumption. The only problem with a research job is if the grant runs out, usually the job is over. But those people that get grants, they're always applying because they want to keep developing the product. They want to keep their jobs also and develop new tests. Notice everything, all the instrumentation is highly computerized. There's lab computer programs. Companies that develop these instrumentation, they have computer people that help integrate the computer into the testing of the instrumentation. You could be a sales rep for the companies that sell reagents or that sell computer systems. You could be a lab tech that works for a computer company that helps in computer installation and training for places how to use their computer. You also can get a graduate degree or a specialty certification. I actually have a specialty certification in blood bank. Actually, I think blood bank is the only specialty that has a blood bank school that you can go to where you can challenge the test. I think the other specialties, chemistry, hematology, and microbiology, I think you can just take the test after so many years of experience. Don't have much else to say about laboratory science, except I found it to be a very rewarding career. I've worked in the clinical laboratory since the early 1970s. I started drawing blood when I was in college. I got a degree in biology, and where I worked, they asked me if I wanted to learn blood bank. And actually, they asked me if I wanted to get into their med tech program, and I did. Eventually, I challenged the blood bank exam and passed it. So, it's a rewarding career. I want to say starting salaries around smaller hospitals are probably $20 an hour or a little bit more, which isn't a bad starting salary. And you can end up making a lot of money and actually have a rewarding career. So if you have any questions, you can contact me at dsaikin@lrhcares.com.